so much appreciate your coming tonight. And I want to, next up is, we have Christy Menke, who has worked as a nurse in Indiana for many years, and I'm going to let her tell you more about what she's done in her career and what she saw, and I think she has some really important information to share with us all from the perspective of a medical practitioner.
Thank you for having me, and thank you for sharing. Hopefully I can shed a little light. I don't know. Okay. Not even sure how to start this. I appreciate everybody having me here, but I'm hoping that if I can just help one person, I have nothing to gain and a very lot to lose by being here, but I think this is very important, and hearing these stories is helping me through this. My journey started over 20 years ago, helping my community with at-risk and underprivileged children. And I needed to subsidize my income for my own children to go to college, so I became a nurse later in life. But my experience covers the ICUs, ERs, every medical surgical unit, of palliative, hospice, LTACs. I've worked in every major hospital in Indianapolis except for one, and quite a few traveling nursing in the suburbians and the rural communities as well. So I'm very well-rounded, and I have always understood that as a nurse we have the opportunity to heal the mind, the soul, the heart, and the body of our patients, their families, and ourselves. And that was what I inspired to do every day. And so in January of 2020, right before COVID hit, I retired from the ICU and followed my PRN career in cardiac diagnostics, which is where we do a lot of testing for heart patients. Still feeling like I needed to do something, I still went to the units to help with procedures and the echocardiograms because they were so overwhelmed. And I even volunteered to be the videographer with families who cannot see their family members in the hospital that were dying of COVID. Probably the most hardest thing I've ever done. My back was killing me holding the videos. I would squeeze the patient's hand. I was in their face with the COVID. I did not care because that family member needed to see their family member for the last time, and that was something that I could give back. I also started in my community for all the corporations testing the temperatures. They didn't know what they were doing. They didn't know HIPAA. They didn't know how procedures for nurses. They didn't know how to educate. So I was helping over 300 personnel every day, exposing myself to COVID. But I knew that the community needed that and that they needed to learn. Unfortunately, I did not realize the toll of the feeling that the COVID stress would have on me and the mental effects that it had on me and my family. It became somewhat of a fad to call us heroes, but in all truth, really, it was a nightmare. The CDC continued to change mask mandates. I have photos and proof of N95s that were supposed to be thrown away that were piled up and gross and nasty and dirty that we had to reuse for 3 days. And there was no protection for us on any of this. We didn't have the superhero clothes to protect us. I felt dirty all the time, and for lack of a better word, a cootie. A lot of my family and friends were afraid of me. The public was afraid of us. You couldn't wear your scrubs. You couldn't tell people you were a nurse or get 20 feet with anybody that you knew you were a nurse. Their body language spoke volumes. My teenager's life was affected as well, as no one wanted their child around a nurse's child. I found myself staying away from my family and friends. I was in complete isolation at times to protect everyone around me from the stigma that I was a COVID-carrying monster. I was alone a lot. But I struggled to find my strength, and even though sometimes I lost sight of who I was, I took those short mental health breaks. I found solace in my farm, my family, and lots of prayers. Going back, I didn't know how worse and how far the rabbit hole we were going to go into. As a nurse, we're taught for evidence-based practice, and we're taught to critically think. I started digging into the CDC guidelines that changed weekly, sometimes daily. And as a nurse, we're pounded to do that, looking at the science I wanted to go straight to the CDC and to Pfizer. I eliminated all the social media guru that was out there because I wanted to know what they were putting out. So I kept that out. I know it's difficult to research that. Their website changes all the time. There's click after click after click after click after click, and the normal person is not going to find that information. But pattern after pattern started to emerge, including lots of word salad lingo, very confusing and contraindicating language, as well as statistics that absolutely made no sense from 16 to 17-year-olds, then lumping them into 16 to 64-year-olds. Evidence-based care is respectful and responsible to individual patient preference, needs, and values, and ensures that patient values guide all clinical decisions. It's so they can make informed decision. Next came the biggest double standards, and one of the largest pandemics hits this nation, and our quiet little unit all of a sudden started flooding after the vaccinations. New onset and numerous cardiac symptoms post these vaccinations included chest pain, shortness of breath, fatigue, abnormal and irregular EKGs, POTS, tachycardia, new onset AFib, and many of them younger male adults. Worst of all, we started seeing spikes in the newborn babies with diagnosis of heart murmurs and PDAs. What killed me the most is there's no documentation or tracking. If we had the biggest pandemic that has ever hit us, wouldn't we want to know if it was COVID related, if it was vaccine related? Why were we not tracking any of this information? Either way, it would have been important for us to understand this. Started to take a step back. Two stories that I'll share quickly. I'm trying to go fast. 18-year-old boy came in after his second shot. Sitting down, his heart rate was 118. Standing, his heart rate went from 156 to 176. He was excited to be a biomed and make a difference in this world. He was full of high hopes and dreams. As much as I put on my game face, he turned to look at his EKGs and tears rolled down his cheek as he said, "That isn't good, is it?" I grabbed his hand and squeezed it and said, "Not where we would like you to be, but we will make sure you see a cardiologist. And you are young." It was my prayer that this was a mild case and he would sail through it. I told myself he was in good hands, but was he? A week later, a patient in his 30s, I could tell he was very anxious and stressed when he came in. I knew he needed my full attention. So I pulled up a chair, sat in front of him eye level, and said, "I have all the time in the world. What is your questions before we get started?" He proceeded to break down crying, stating that his chest pain did not start until after his second vaccination. He didn't want to get it, but was fear-struck by his MD and took it because he wanted to do his part. For the first time ever, I've only heard about vaccination shame, but I knew that this was happening in front of me. What do you say in a moment like this? I prayed again and asked for the words. You made the decision that you felt was best after speaking with your doctor. There is no shame in that. You did the right thing by educating yourself later and coming into the hospital. Although his EKGs were abnormal, I reassured him that he was in good hands, but was he? Further research led me to the other fact that the patient-centered care by summer of 2021 was completely gone. Although CDC was changing all of their vaccine information to include Guillain-Barré, myocarditis, pericarditis, or any other symptom other than that, it was not being included on the vaccination education sheets. Why? If it was important enough for the CD to post it in big boxes, then it should have been important enough for patients to be informed of it. I am a good nurse and I'm a compassionate nurse, but I have a conscience that outweighs everything I do. My patients were not getting informed consents. Following this, it just got worse. The stupidity, pretty much the mandates, the religious discriminations. I don't even know where to go with that. I was not giving any opportunities. They would continually harass us, delay any answers, computers went down. I had to hand deliver. I would turn things in a timely manner. It just didn't matter. It just kept going. Even though I was granted the religious exemption, I was informed without any conformed consent or HIPAA that I would have to do weekly testing. Even if I decided to take a leave of absence and was not at the hospital, I would still have to do that testing. It just, at this point, I was pretty much done. All in all, I learned from my staff and my friends and my peers of denials of medical exemptions for people with MS that they refused even in doctor statements. Nurses who were crying and when it was time for them to get their vaccinations and other nurses giving it, but they did not wish to get it, but they were the only breadwinners. To me, that's forceful onto the nurses. Post that threats that all the unvaccinated should be branded, managers making fun of the unvaccinated staff, stripping of PTO healthcare workers who did not apply, branding nurses' badges with a bold color to show everyone that they were not vaccinated, coercion on bonuses, just on and on and on. This breaks everything that JACO says of workplace harassment, yet we were compelled to stay there. The straw that broke the camel's back is a personal story of my grandmother. She is 89 years old and she refused to get the COVID vaccine. She's 89. She did contract COVID from another family member and had very mild symptoms. They refused treatment. They told her that she brought that on herself. She did not get any pre-treatments, no nebulizers, no the Zithro that most of the other people I heard were getting. They said that since she brought it, she needed to go home with Tylenol and get over it. Due to her weakness, she took a fall, hit her head, and she went to 2 other hospitals that knew she was post-COVID, and they refused any other treatment to her. I was in there and saw that she was having seizure-type activity and took her to the one hospital that does care about what I think and cares about me as a human. In the one hospital I have not left. She did get the treatment she needed, but I don't understand. I don't understand why she was refused, and it took 3 hospitals to give her any type of treatment. She was landed in a rehab where they kept us from any visitation, so she lost hope, fell again, and now we're done. So you asked me as a nurse, personally, I've been there, I've done it, I've seen it. I was flooded again with phone calls from friends of what the healthcare is doing to them. MDs continuing to badger patients, refusals of patient treatments or care, refusal of education and medications. I have even had a family member that was refused to make any decisions in the medical of a COVID family member that is on the vent right now. So they were not allowed to help in making any of the medical decisions. What are we doing? So what did I do? I walked. I prayed. I prayed a lot. I did not sign up for this. This is not what we do. If there is any medical people out there and you cannot find the dignity and respect that you need to give to these patients, then you need to leave, because this is the crimes against humanity when we don't take care of our patients. We don't give them informed decisions. We don't track what's important for people to know. For all the rest of you, if you're discriminated against or harassed, please file. You've got Hoosiers, you've got people that'll support you, you've got JACO waiting to hear from you, whether it's a family member or a medical. We have to start reporting this. I'm going to leave you with this. As a nurse, I solemnly pledge myself to the service of humanity and will endeavor to practice my profession with conscience and dignity. I will maintain by all the means of my power the honor and noble tradition of my profession. The total health of my patients will be my first consideration. Until this returns and is honored as my beliefs, I will continue to walk away. To my country, I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.